Do you have any specific techniques that you find you're reaching for more often, or kind of deliver results over others? Anything that you might want to kind of point people to in this article?
I think working with younger children and working with children in play therapy does need really specific training. It's not something we can just necessarily read in a book. And I've done lots of training over the last 20 years in this space. And in fact, I just trained some psychologists yesterday. And these were three things that they said. I've changed it up a little bit to protect them. But one person said, I've started doing play therapy with children, but I'm really confused. Do you talk to them or play with them? Great question. My office is full of toys, but I'm not sure what to do with them. Great question. I've been counselling adults for 20 years and have now found myself counselling children, and I'm really fumbling. I don't think play therapy, child-centred play therapy, which I find the best and the most engaging way of working with children. I've had children who've been bribed to come to counselling who get paid more by their parents than their parents pay me, because children do not want to come most often to counselling. They've had bad experiences of being tortured by an interrogation of questions that make them feel really unsafe. The very next session, after the first one where I've let them lead the play, they've run ahead of their parent, and I have to wait to wave the parent into the waiting room before I can start the session, because I can't wait to get started, because they enjoy it. And these methods of child-centered play therapy are about actually doing less than doing more. They're not about curing, fixing, changing the child. They're not about doing to. They're not about trying to resolve the child's problems. In fact, they're about allowing the child to make their own choices in play so that the child can build a sense of autonomy, authority, and ownership of their own decisions where appropriate, obviously for the little things, so they can feel more confident in the big things. And when they're more confident that they can make choices about how, with what, and when they play, they're going to be more relaxed and play out what is of concern to them. So it's going to be easier to see and hear and support them in that change than it would if we're doing talk-based therapy. So if I explain the methods to you, you'd think that's really simple, but it's actually really hard to do because we're so used to praising children, saying, wonderful job, that's a great puppet show. We don't do that. Suggesting that children might draw a picture of something particular. We don't do that. Picking up the helpful nurse and saying, you've got the helpful nurse. We don't even label the toys children are using. So actually it's quite a simple method, but super hard to learn, because 90% of what we need to do in learning child-centered play therapy is unlearn all the ways that we might typically be with or play with children outside of that therapeutic space. So that would be my number one go-to, to get people to read more about that, to learn more about it, and to do, even short courses in it. That would give them ongoing PD, that would give them a supportive community, and that would give them skills and confidence to be able to work well and effectively with children.